At Trillium Health, our designation as a federally qualified health center lookalike and Ryan White Clinic allows for our participation in the 340B drug discount program. Through this program, we are able to offer prescription medications to our patients at little or to no cost, and to provide comprehensive services and reach communities of people at risk for health disparities. We know firsthand that adherence to medications is an important contributing factor to achieving better health outcomes, and prescription drugs must be affordable. No one should go without the drugs they need to manage their health. We support the legislation that's being proposed that expands access to outpatient prescription drugs to all, and we believe all Americans are deserving of access to affordable prescription medications, including our older adults. Please let me welcome Senator Gillibrand, and we thank you for your efforts to ensure access to prescription drugs for older adults and those with chronic conditions. Welcome.
Thank you so much. Thank you, Andrea. I'm going to not use that because I need my hands. Okay. Thank you all for being here. I want to thank Andrea for hosting us in Trillium Health. I want to thank our state senator, Jeremy Cooney, and our assemblywoman, Sarah Clark, for their excellent advocacy on the state level to talk about something on the top of a lot of Rochester families' minds, which is the cost of prescription drugs. Here in America, we pay far too much for prescription drugs. We pay the highest prices in the world for prescription drugs. And while families face unprecedented health challenges and financial insecurity over the last year, drug makers actually raised their prices for 860 prescription drugs, and they made billions of dollars in profits. For the millions of people who have lost their job and their health insurance, paying for those life-changing and life-saving drugs is harder than ever. I've talked to people across New York about this issue. I've talked to older adults and people with disabilities who have had to make the impossible choice between paying for their rent and paying for their medication. I talked to one health insurance counselor who works with people who need insulin and drugs like Humira. And the fact that Humira costs $1,500 a month is making it just unaffordable. I've also talked to people who've had to ration their medicine like insulin, which can be deadly, and who literally can't afford to miss when they're putting eye drops in their eyes for glaucoma, when that costs hundreds of dollars a month. These folks are not alone. 30% of adults have said they've not taken their prescriptions as prescribed in the past year because it just costs too much money. Healthcare is a human right. It's not a privilege, but right now life-saving medication is only life-saving if people can afford it. This is a health crisis, especially for our older adults, who account for more than 1 in 6 people in Monroe County. Even with help from Medicare, the portion of prescription drug costs older adults are responsible for can be overwhelming on a fixed income. Nearly 9 in 10 older adults take prescription medications, and 1 in 4 say it's difficult to afford them. Making prescription drugs more affordable is one of my highest priorities on the Aging Committee. That's why I'm supporting a package of bills that I think will make drugs more affordable. First is the Medicare Drug Price Negotiation Act. This bill allows the Secretary of HHS to negotiate for lower prices for Medicare in the same way she does for Medicaid and the VA. Medicare pays on average 3 times more than Medicaid pays for the same drugs. If Medicare could negotiate for lower prices, it would save our seniors and government money. The CBO estimates that this would save the government $450 billion over 10 years. That's money we could use to address so many of the other health challenges like healthcare and like affordable child care. President Biden talked about this in his address to Congress, and it's a policy that 88% of Americans support. The package also includes 2 bills that will level the playing field and the market for Americans purchasing prescription drugs by aligning the prices to prescription drugs in the US to Canada, UK, France, Germany, and Japan, by allowing patients, pharmacists, and wholesalers to import lower cost drugs from other countries. It would also allow New Yorkers to get their drugs from Canada. These are common sense reforms that is the time to make them. I will keep on working to make sure that we have access and that people can afford the medicines they need to survive. I now would like to introduce our Assemblywoman, Sarah Clark.
Hello, everybody, and I'm really excited to be here to talk about a very important issue. I'd like to first thank my former boss for her tireless advocacy on prescription drug costs, and these continue to be a problem, and it's not going away. I also want to thank Trillium Health. We were excited in the state legislature and this year in the budget to continue to support their 340B program that allows prescription drugs to be affordable for so many. So thank you, Andrea, for your commitment to your patients. You know, before the COVID-19 pandemic hit, we knew many people in upstate New York were driving to Canada for lower drug costs. That hasn't been an option since the border's been closed. We know seniors are choosing between paying rent, buying food, and their life-saving prescription drug costs. This problem needs a solution. We know, I've heard a story of a woman who took a job and came off Medicaid, and she lost money every month by working because her private insurance no longer paid for her prescription drugs. This is a problem that is not going away. These 3 common sense solutions will go very, very far to make a difference for so many, so that no one is choosing between the things that they need every day in their lives and the medicine they need to stay healthy. So I'm just really excited. We will continue to work on the state level to do everything we can around transparency and making sure places like Trillium continue their programs, but we need more help, and we need it on a federal level. So I'm just really excited to be here with you today and thankful for your advocacy for our seniors and for so many that can't afford these drugs. So thank you.
Thank you, Sarah. Our next speaker is Senator Jeremy Cooney.
Thank you, Senator. I want to just say 2 things. First, you hit the nail on the head when you said common sense, Senator. This is common sense. We talk about prescription drug prices time after time after time, and yet we're not doing those common sense measures like group buying and relying on our neighbors to our west. These are things that will really impact everyday New Yorkers and Americans that you represent across this country. So thank you for your leadership, because quite frankly, we can't do it alone at the state level. We can talk about healthcare as a right. We can talk about making our Medicaid more affordable so that we can keep our taxes in line and do all the great programs we want to do at the state level. But without leadership from Senator Gillibrand leading the way on the Aging Committee in the Senate, making sure that she's standing up for New Yorkers that we represent right here in Rochester, this would not happen. So we thank you and we support you fully, and we know this legislation will make a great deal of difference in the lives of New Yorkers and Americans for many years to come. Thank you, Senator.